There are times There are times when you may ask questions and you are left alone and you do not have who to turn to. There are times when you don't know what to do, what is right, what is wrong. You don't know whether to go for a walk. You don't know whether to sleep on your side, on your tummy. You don't know what to eat. At times, the journey is so strenuous. And that is why APA came up with the Moms Club, so that together as mothers, we can all join together and walk together. So in this program, we'll actually be looking at a lot of things, and we ask our viewers to say put, especially if you are on our WhatsApp. If you're not on our WhatsApp, kindly join our WhatsApp. We'll be sharing the link at the end of the presentation, whereby feel free to ask questions. We have days, different events for each day. We will be posting once we are through with this presentation, what you can eat, what you can do, ask the doctor, and to cover it all, we'll be having also posts that are thrown in, which, oils you can buy, about stretch marks, how we can go back, how we can lose the baby weight, and all these things that mothers experience, especially after delivery. But today, as we begin the journey, we are going to begin on the preconception and the journey to the delivery. And I don't want to take much of your time because we want to take the shortest time possible. That is why this morning we are really honored to have the presence of Dr. Muthoni Ritho. Dr. Muthoni Ritho is one of our main gynecologists who is currently located at the women's clinics. She's a consultant obstetrician gynecologist, and she's a reproductive endocrinologist, a fertility specialist, and all this in one. She's also a lecturer at the School of Medicine. So without much, I think, Daktari, you are there. I don't want to preempt you. I would want you to pick it up from that so that you can walk our mothers through the challenges they have. Karibu sana, Daktari. I don't know if you can hear me. You can unmute yourself. Daktari, you are able to unmute yourself? We may hold on for a minute. We try and get Daktari on. I think she's having a bit of a challenge on her side. Daktari, I don't know if you can talk now. Are you able? We want to apologize. Daktari is having a challenge as the team tries and picking her up. Probably from where we sit, we can just be looking at the common, common symptoms in pregnancy, the common challenges that we have. Probably we can be thinking of, you know, um, common health problems in pregnancy, back pain, pregnancy, bleeding, in pregnancy. Headaches also may come in pregnancy. Injection and heartburns are quite common in pregnancy. Leaking of nipples, very common. Nose bleeding can happen in other cases. Pelvic pain is normally a very common problem also when it comes to pregnancy. The reason why maybe we get constipation in pregnancy, it's because of hormonal changes in your body and may cause you to become constipated during your early stages of pregnancy. To help prevent this, we will be posting different types of meals on the chat. So you would request you to stay put. We'll be posting the types of food that you can eat, maybe foods that will be able to help you with the constipations, foods that are high in fiber, such like wholemeal breads, cereal, fruits, vegetables, such like we'll be giving you what we call a healthy, meal plate that should be able to assist you in that. Um, Exercise, but not so much. We'll also be posting what kind of exercises. We encourage plenty of water. Please try and drink as much water as possible, not in excess, but just enough. Okay, and then we may also experience some cramping in pregnancy. We will be posting that also so that you can be able to go through them and you are able to walk comfortably. Daktari, I don't know if you're back. Daktari, can you hear us?
Yes, I can hear you.
Though you are echoing.
I've logged in on a different device.
Yeah, I can see your picture is different.
I'm trying to
Yeah.
figure it. So
Okay. I think you're still echoing. Your sound system is not very clear.
yes, the echo is gone. I've logged in on my phone.
Okay.
So I will need assistance to project the presentation.
Okay.
Yes, I think that will be the easiest way to go around the problem because I can't
No,
unmute my computer.
the presentation is on, Daktari. Can you see it?
Okay. Yes, I can.
Over to you. I'll just be chipping in places whereby the echo is too much as we work on it. I hope your computer can be back as they work on it.
Okay. Well, someone is
Okay.
trying to work on it.
Thank you, Dr. I had already introduced you. Kindly pick it up, and we won't mind you introducing yourself again. Karibu sana, Dr. Muthoni.
All right. Thank you, APA team, for the invite to talk to the mothers and potential mothers and their partners, hopefully, who are going to support them in this journey. Welcome, our moms. We are glad to have you with us. Today, we'll be looking at beginning the journey to pregnancy, what we call preconception care, and the first trimester, which is the first third of pregnancy. So my name is Dr. Muthoni Ritho. I'm an obstetrician gynecologist. I also have special interest in helping women get pregnant. That I'm a fertility specialist and also a reproductive endocrinologist. A reproductive endocrinologist basically just fixes abnormalities in reproductive hormones in women. So we'll go straight to our presentation. It's going to be short and concise. Hopefully, we'll all keep you all engaged. So we can move on to the next slide, please. So when you're beginning the pregnancy journey, we hope that we'll all be intentional mothers. And when you're beginning the pregnancy journey, we start with what we call preconception care. Preconception care is basically the care we give to women when they are planning to get pregnant. It includes biomedical. Biomedical means maybe tests you do, investigations you do, drugs you do, you're given. Behavioral means probably change in behaviors, maybe like nutrition, sexual behavior, lifestyle issues like smoking, alcohol consumptions, and social health interventions to women and couples before conception occurs. Why is it important? It has been shown that if you start your care earlier on, before you actually get pregnant, you're able to optimize your health. Optimize your health means you make the conditions in your body as close to best as possible before you actually get pregnant. And this has been shown to improve maternal and child health. Who needs it? Basically, all women of reproductive age, and more importantly, their male partners, or partners or significant others. We avoid saying husbands because we realize situations can be different and very complicated. And what do we focus on? We focus on three things: management of long-term health conditions. Maybe you're hypertensive, maybe you're diabetic, maybe you have a kidney issue, anything, asthma, any of those long-term health conditions would need to be managed properly before you actually get pregnant. We also focus on assisting you to cease risky behaviors. Risky behaviors can be things like alcohol consumption, smoking, and such like things. And more importantly, promoting healthy behaviors like good nutrition, healthy sexual behaviors, exercise, and such like things. Next slide, please. So which women are especially at risk when they're trying to get pregnant? Several things can make you be at risk. One of the things can be a pre-existing medical condition. Pre-existing medical conditions include things that can be worsened by pregnancy or things that can worsen pregnancy. And these include things like hypertension, infections you can pass on to the baby like HIV, syphilis, and such like infections. It can also be conditions that can interfere with your normal function during pregnancy, like tuberculosis. Also, tuberculosis is a condition you can pass on to your baby during breastfeeding. It can also be reproductive tract health cancers like breast cancer. Breast cancer can interfere with your ability to breastfeed a baby. And reproductive health cancers can complicate your pregnancy. In addition to that, the medications we use to manage these problems can be potentially unsafe for the baby. Also, cervical cancer, some of the treatments we use for early cervical cancer can cause problems in the pregnancy. It can also be something that has happened prior, like in your like a surgical history. Like if you've had fibroids removed, basically there is a duration which you're supposed to wait before you get pregnant. And it also means once you've had surgery for your fibroids, probably a normal delivery might not be a feasible option for you. If you've had previous cesarean sections, it's important to know why they were done and what complications arose, so we see how to manage you better this pregnancy and also determine the type of delivery you might have, whether it would be a repeat cesarean section or you try to have a normal delivery after a cesarean section. Also, if you've had history of obstetric fistula repair, it would mean that you're potentially at risk of getting it again, so you'd have to manage your pregnancy very carefully. It can also be things in your obstetrics or gynecological history. Like if you've had history of miscarriages, it's important to have a diagnosis of why you are having the miscarriages and interventions put in place so that you don't have a repeat of the same in the current pregnancy. Also, you may be advised as soon as you get pregnant to start seeing your doctor, because depending on what was causing the miscarriage, you might need to start your treatments early enough to prevent a repeat of the same. Also, if you've had a previous preterm delivery, you would need to establish the cause, and so that you're able to put measures in place to prevent a recurrence of the same. If you have STDs and reproductive tract infections, like we said, some of them can complicate pregnancy in that they can be passed on to the child, and some would require treatment before you get pregnant so that you don't pass them on to the child. If you have menstrual disorders, either your periods are irregular or too heavy or too light, we need to find out what is wrong, because some of the causes of these menstrual disorders can result in delayed fertility or infertility or recurrent pregnancy loss. And some of them sometimes may need an intervention before you actually fall pregnant. For example, if you have very large fibroids that we think might be risky for the pregnancy, we may advise for you to have them removed before you actually get pregnant. Also, if you've had a prolonged period of trying to get pregnant and you don't know what is happening, it would be important to see the doctor to be evaluated what the problem is, because some of the reasons that cause subfertility can also increase risk of pregnancy loss. Then also we are worried about the environment. In the environment, we're worried about exposure to maybe radiation or chemicals that can harm the baby. And chemicals don't always have to be like somebody working in the chemical industry. It can be like some of the dyes people use in their hairs, for people who do painting, for people who work in what other industry besides even healthcare. Some of the things like pharmacists inhale can also be dangerous to the baby. Then occupational history, the type of work you do, the length of your working hours can also be a problem when it comes to pregnancy. Athletes are also at risk because most of them, what they do is physically strenuous. Bicycle riders, this is especially for the men because it can interfere with the sperm quality. Again, occupation, if you are exposed to any radiation and chemicals, especially the women who work in the chemical industry, you would need to reconsider this before you fall pregnant. The nutritional history, like people who are strict vegans are people who don't eat meat and meat products. They tend to be deficient in some vitamins, especially folate, which is dangerous for pregnancies. Also, if you're underweight or overweight, it can be potentially risky for your pregnancy. So all those women tend to be more at risk than regular moms. However, like we said, all moms should endeavor to have preconception care before they get pregnant. Next slide, please. So what happens when you go and see a health provider for preconception care? The first thing, they will have a chat with you, discuss like the things you've discussed in the previous slide, whether you're experiencing or having your those things going on in your body. Then secondly, you will get screening for conditions that can affect pregnancy and infections and evaluation for possible causes of previous poor outcomes. So you will find you probably need to be evaluated for reproductive tract infections, at a bare minimum, at least HIV, syphilis, and hepatitis B. You'll also be advised to get a pap smear. It's important for all women who are sexually active of reproductive age to rule out cervical cancer because it's common in our setup. We'll also check your blood sugar to rule out diabetes. We'll also check your blood pressure to rule out hypertension. We'll check your weight and your BMI. And if you're overweight, probably you'll be put on a nutritional and an exercise program to help improve your weight. If you're having undernutrition, probably you'll also see a nutritionist to help you to optimize that. And if you've had previous bad outcomes in pregnancy, we're looking at pregnancy losses. We're looking at what else? Stillbirths. We're looking at maybe a previous child who was born with something like cerebral palsy. If you had prolonged labor, would need to look at all those things so that you're able to plan better for the next pregnancy. Then secondly, if we realize that you have a pre-existing condition, like for example, you have diabetes, one of the things we need to ensure is that whatever condition it is, you have best care for that condition. So like for diabetes, that your blood sugar is okay. And secondly, if you're using any medications, that these medications are changed to medications which are safe in pregnancy, which are not harmful to the baby. And this applies to all conditions, whether it's a thyroid problem, a hypertension issue, even HIV. If you're taking ARVs, you probably sometimes may need to change the ARVs to medications which are safe in pregnancy and ensure the viral load is good for the baby. Then also you get counseling. And counseling is wide. Number one, you need to be counseled on the number of pregnancies you want to have, the timing. Also, timing means like the space in between the pregnancy. If you have any genetic problems, the commonest one in our setup is sickle cell disease. If you're a carrier of the trait and your partner is a carrier of the trait, you probably be counseled on the risk to your children. Then you make a decision whether you still want to marry that partner or another partner. If you've had a previous baby with a birth defect, then you'll get counseling of risk of recurrence of the same type of birth defect in subsequent pregnancies, and you're able to make an informed decision. You also get counseling on healthy sexual practices to avoid new HIV and STD infections while you are pregnant. You also get lots of health education, and the health education revolves around stopping risky behaviors, especially substance abuse, and also risky behaviors when it comes to multiple sexual partners. We also advise women on prevention and management of gender-based violence. Then in addition to that, you'll be put on folic acid supplementation when you start trying to get pregnant. It's an important supplement that prevents some types of birth defects, especially of the brain, the spine, and a cleft lip. Then in addition to that, nutritional care and weight management is done. And this has become very important in the recent years because we realize quite a number of our women have overnutrition. Overnutrition means your weight is a bit more than we'd want it for you before you're getting pregnant. Next slide, please. So now when you do get pregnant, like we said, maybe you'll hear us saying first trimester, second trimester, third trimester, maybe to orientate our new moms or moms who've never had this system of, of grading pregnancy. Pregnancy is divided into 3 parts, depending on the timing, or basically thirds. So the early pregnancy, which is the first third, is the first trimester, which is the first 14 weeks. Then we have the middle part of pregnancy, which is the second trimester from 14 all the way to 28 weeks. Then we have the third trimester, which is 14 weeks all the way to term, which is around 40 weeks. So today we'll be focusing on the early pregnancy, which is the first trimester, the first 14 weeks of pregnancy. So why is this first trimester important? Number one, it's a critical time for several reasons because commonly most women are unaware they are pregnant. Like most of us know, you know you're pregnant after the event. Maybe you missed a period for a week or two. That's when you decide to test. And even by the time you test, your baby has probably been in your body for 2 to 3 weeks. So if you are taking something that you shouldn't be taking or using medication that you should not be using or consuming alcohol, it means you've already exposed your baby to this for at least 2 to 3 weeks. Secondly, it is the most critical time for development of the baby because all organ systems occur at this time. So this is also important because exposure of the baby to harmful agents has the most impact at this time. And also this first trimester is important because it can be complicated in some women, especially the women who have miscarriages, they commonly occur at this time. Also, if you're having an abnormal type of pregnancy, an ectopic pregnancy, it's likely to complicate and be diagnosed at this time. Also, this is a time some women get very severe nausea and vomiting, resulting to a condition we call hyperemesis gravidarum. So this is quite a critical time for the women. Next slide, please. So what do you expect in the first trimester? First of all, we congratulate you that you're pregnant. How soon can a pregnancy test positive? So commonly what we normally use is a urine test, which is what is available while living at the pharmacies. It's commonly positive 2 weeks following conception, which is usually around roughly 4 weeks from the time of the previous period. It is also normal not to experience any symptoms and signs. So the fact that you're not experiencing anything does not mean you're not pregnant. And in the event that you develop signs and symptoms, commonly what women experience are nausea and vomiting. It's commonly called morning sickness, but this is not actually accurate. It can occur at any time. I've had patients who have lunchtime illness. I have patients who have nausea just in the evenings. So it doesn't necessarily mean it will occur in the morning. It can occur at any point in the day. You can have nausea and no vomiting, or you can have both nausea and vomiting. A second common thing women experience is altered taste in the mouth, which can lead to women eating selectively. They tell you this tastes weird, this doesn't taste as nice as it used to be. For some women, it can be so bad that they just feel like spitting all the time. Another thing women can get is constipation or a runny stomach, sometimes even indigestion, heartburn, and bloating. And commonly, women are misdiagnosed with infections of the stomach and they are put on antibiotics. They're told they have typhoid, but really all they are is pregnant. Then another thing women might experience is mild discomfort in the lower tummy. Commonly, it's due to rod ligament pain. A long time ago, midwives used to tell women it's the uterus growing, but really it's not true. It's just stretching of the round ligaments. Then in the breasts, you may experience sensitivity, there may be pain, the breast may increase in size, and sometimes for light-skinned women, the veins may even become visible. Some women do experience spotting around the time of the expected period. Sometimes it's called implantation bleeding, but it's usually a normal event. The other thing women can get are mood swings, excessive fatigue, and sleepiness. And these patients usually say they feel quite lazy during this trimester. So those are the normal signs and symptoms you expect to experience in early pregnancy. So is there anything you can do about it? For nausea and vomiting? Well, you can take small feeds frequently. You can also try and take things with ginger. There are some ginger capsules you can take, or gum or ginger tea. It may help. If it's very severe, there are medications available for this. You can get them from your doctor. Please do not buy them over the counter because not all of them are safe in pregnancy. For constipation, we encourage you to hydrate a lot, take a high fiber diet, meaning lots of fruits and vegetables with every meal. For heartburn, you can reduce the spices in the food you eat. And if it's really bad, you can get some antacids, again, from your doctor. For breast sensitivity, there's not much you can do, but what we encourage you is to wear a supportive, well-fitting bra to decrease the jiggling effect for the breast so that they're more comfortable. For spotting, if it extends beyond that time of the expected period, please see your doctor. It can be a potential danger signs. About the mood swings and excessive fatigue, we just advise you to rest a bit more and practice self-awareness so that you don't say things that you'll regret a few minutes later. So next slide, please. So what development occurs in the baby in this early part of pregnancy? By the 4th week of pregnancy, like you can see in our images, the baby is shaped like a tadpole. It has hands and legs that they're starting to grow, and all the major organs have begun to develop. So that's around uh, the 4th week. Then, most importantly, the baby's heartbeat starts by the 3rd week after conception, which is roughly 5 weeks from your last period. So by week 8, your baby starts having a human shape. The head is usually a bit larger than the body. The eyes are evident. The ears are there. The mouth, the head, hands, and the legs are seen. And all the organ systems are developed. Everything, the heart, the brain, the kidneys, the gut, the reproductive organs, they're all there, just that they're small. And the baby starts moving in the mother's womb, even if the mother is not able to feel it. And the reason the mother is not able to feel it is because the baby is still very, very small. Between week 9 and 12, the external genital organs are well developed. The baby starts getting fingernails and toenails. The arms and legs are fully developed. The baby has eyelids and the fetal movements increase. So like we said, if you look at our timeline, these first 2-3 months are very critical for development of the baby. And like we said, if you expose the baby to any chemicals or agents that are likely to disrupt the development of the baby, they will have the most impact at this time. So next slide, please. So what do you do during the first trimester? Like we said, when you're trying to have a baby, you start taking the folic acid. When you do get pregnant, you keep taking the folic acid, and we encourage you to take it until around the 3rd month of pregnancy, that is 12 weeks. We also encourage you to start attending antenatal clinic anytime between week 8 and 12 for your first visit. And during this first visit, we will do a viability scan to confirm that the baby is in the right place, it has a heartbeat. It can also be used to determine the age of the pregnancy, especially for women who are unsure or have irregular periods. Secondly, you'll have a combination of tests done, which are called the antenatal profile. So the antenatal profile is composed of, we check your blood group, we check your blood levels, we check for infections you can pass on to the baby like HIV, syphilis, and hepatitis B. We also do a urine test, and I forget one more. So all those tests are supposed to check whether if conditions in your body are optimum to carry a baby. We also check your weight and your blood pressure to rule out diabetes and also obesity. You will also we put on supplementation. If you're not put on the supplementation, the basic minimum supplementation you need to take for pregnancy is iron and folic acid. It comes in a tablet called IFAS in the government facilities. If you're able to afford maybe better supplementation, there are different formulations for prenatal supplementation. Then another important thing we do around 12 to 14 weeks is Down syndrome screening. And this is for women who are aged above 35 years old, because the risk of Down syndrome increases for women above 35 years old. Then also we reduce harmful exposure to the baby, meaning if you are taking any substances like alcohol or smoking, you stop. If you're on any medication that's potentially harmful to the baby, you'll be asked to stop. Then we ask you to rest enough. Like we said, early pregnancy is associated with a lot of fatigue. Yeah? So resting enough is important, and resting enough means at least you get to sleep for at least 8 hours every day. And then for nutrition, we ask you to take a balanced diet with adequate hydration. The reason we don't specify what specifically to eat is because we realize in our country, we have such a wide cultural diversity that what people will eat in one part of the country will not be what people will eat in another part of the country. And also for women who are suffering from altered tastes, they may favor certain foods over other foods. But the important thing is to make sure that the diet is balanced. A balanced diet means it has some protein. Some protein can be either animal-based or plant-based. So animal proteins, you have the meats, the eggs and meat. The plant-based proteins, you can get proteins from beans, from lentils, from peas, and those foods. Then for carbohydrates, that's the rice, the chapati, the potatoes, the spaghetti, the sources of starch. And then you also need vegetables, which is your source of vitamins. Vegetables can be anything, greens, cabbage, carrots, all those things. Those are vegetables. So your plate should have all those food groups. Ideally, the vegetables should be half of your plate, proteins a quarter of your plate, and carbohydrates a quarter of your plate. Then if you're suffering from severe nausea, we advise you to take small, frequent meals. Like the way you feed a baby, just small meals, but frequent, like every 2 hours you take something small. And if the nausea is really bad, you might do better with dry snacks. Dry snacks are like maybe a mandazi, a biscuit, a cracker, and so on, as opposed to liquidy stuff. And then also we advise you to have safe sexual practices. The reason we insist on safe sexual practices is because we don't want you to get new HIV infections when you are pregnant, because new HIV infections are associated with a very high viral load, which increases risk of transfer of or transmission of HIV from mother to child. Also safe sexual practices so that you don't cause self-injury during your sexual practices. So next slide, please. So this first trimester, are there any symptoms that are worrisome? Yes. And in case you get any of these symptoms, you would need to see your health provider immediately. The first one is any form of bleeding. And the reason it's important to see your doctor if you have any form of bleeding is because bleeding can be associated with miscarriages. It can be associated with ectopic pregnancies. It can also be associated with infections. And all those are conditions that would need to be addressed. Also, if you have excessive nausea and vomiting, it can compromise your nutrition. And it can even, if it's really bad, it can also cause organ failure, especially your kidneys, like if you're not retaining any feeds at all. So if you have excessive nausea and vomiting, kindly see the doctor to either put you on medication. And if it's really bad, sometimes you can even be admitted until it resolves. Also, if you have persistent lower abdominal pain, it's important to see your doctor. And this is because it can be a symptom of an infection, especially a bladder infection, a UTI. It can also be a symptom of a threatened miscarriage, Also, for women with ectopic pregnancies, they may also experience low abdominal pain. So it's important to have it assessed to know what is causing it and have the cause managed. Also, if you have any abnormal vaginal discharge, which is suggestive of infection, the infections will need to be managed, because if they go unmanaged, they can increase risk of preterm labor or even abortions. If you have severe headaches, it's also important to see your doctor. Severe headaches can be an indicator of high blood pressure. If you have pain when passing urine, it's important to see your doctor, because it's suggestive of a urinary tract infection. If you have any condition causing fever, you need to be managed, because such conditions can increase your risk of a miscarriage. If you have extreme dizziness or weakness, it's also important to see your doctor to rule out low blood levels and diabetes. Then also a disclaimer: if you're going to see a health practitioner, whether it's a hospital or a pharmacy, and you're going to get any medication, it's important to always declare that you're pregnant, so you're given drugs which are safe in pregnancy. This is important because in the first trimester, it's not always obvious. It's not like in the last half of pregnancy where your belly is evident and people can see you're pregnant. In the first trimester, probably only you and your partner know. So always declare that you are pregnant whenever you go to a hospital, so that you don't get drugs which are harmful to our baby. Next slide, please. I think that brings me to the end of my short presentation. In this picture, you can see our office. It's located at 40 Suits in Upper Hill off Hospital Road. And thank you very much for your attention, and your questions are welcome. Thank you.
Thank you so much, Daktari. That was very, very, very elaborate. Now we know where we are. If among us we have a mother who is starting the journey, now you know where you are. So kindly keep on posting your queries, and Daktari will address. They really don't have to be questions related to the presentation, because today we have the honor of having Daktari on. So kindly keep your questions coming. Daktari, I have a viewer. I am in the first trimester and I am having discharge. Is there any cause of alarm?
Okay, thank you for the question. So in the first trimester, one of the changes you get, which is normal in pregnancy, is an increase in the amount of discharge. The normal discharge you expect is milky, like milky white, and no smell and no itch. If your discharge has an off color, it has an off smell, or is associated with itchiness, then that one would be suggestive of infection. You need to see your doctor.
Looking at another question here that is just coming in right now. Give me a minute. A patient here is saying she's suffering. It's not a patient, a mom. She's actually suffering from severe back pain in her. She's 6 weeks pregnant, and she cannot be able to do her normal chores. Could she be having a problem, or what would be your opinion?
Okay, so 6 weeks is quite early in pregnancy. We would not expect such levels of severe back pain. So what I'd recommend is she sees a doctor for an evaluation to establish what the cause of the back pain is, because it's not normal to have such severe back pain in early pregnancy.
Thank you, Daktari. Another viewer is asking, is iron and folate the same thing? Does Promiba gummies have enough folate or iron?
Okay, so iron and folate are not the same thing. They are different supplements. Iron goes to build blood. Folate can be used to build blood cells, but also do other functions. So they're not the same thing, but you can find them combined in one tablet. Like in the government setup, it's combined in a tablet called IFAS. Then I'm seeing the second half of the question is about the Promimba gummies. Yes, they have enough folate, and they have enough supplemental iron. However, if at any point you have low blood levels, you would need additional iron. The one in Promimba gummies is just enough for a normal pregnant woman. If the blood levels are low, then you'd have to take extra iron in addition to the one in the gummies.
Next one should be, how would you treat a woman who gets pregnant and contacts syphilis in her first trimester?
Okay. So, contracting syphilis is not a problem. The important thing is to have it diagnosed. And once it's diagnosed, there is a series of treatments you get, which are injections, which you can get while you are pregnant. It's penicillin injections. But of course, again, see your doctor. They will prescribe the injections and you will get them and they will cure you of the syphilis.
Thank you. I believe we've learned something there, all of us. Please touch on gestation diabetes and how to avoid going into medication. If your urine test has shown high glucose, the fasting test is yet to be done. Let me
So
just
there are
repeat that.
several. Mhm.
Yeah, just proceed, Dr. You've gotten the question?
Yes.
Okay.
So there are several aspects to this question. The first thing is that she has sugar in her urine. Not all sugar in urine is diabetic. So the fact that you have sugar in urine should not alarm you too much. But if you get it, then you should get some series of tests to check whether you're diabetic or not. And there is a standard of practice, like all women ideally in Africa, because being Black is a high risk for getting gestational diabetes, should be screened for diabetes between 24 and 28 weeks of pregnancy. It may be done earlier, like if you have a symptom that's suggestive of high blood sugar, like if you have too much glucose in the urine. And for gestational diabetes, we diagnose it after we do that test I was talking about. It's called an OGTT. And then depending on the blood sugar levels, there are some that you must go into medication. If they're really high, then you must take medication, and the medication options are some tablets or insulin. If it's not too high, then probably the doctor will be happy enough to put you on a diet, but with close monitoring of the sugar. And the monitoring for the sugar we do are two tests. Like if you're on follow-up for gestational diabetes, you'd need to do a fasting blood sugar. That's a fast sugar when you wake up in the morning before you eat anything, and a sugar level 2 hours after you take food. So once you get gestational diabetes, you really can't go back. It's just a matter of managing it. Can it be avoided? Yes or no? Yes, if you have a risk factor, especially the commonest one we have in our setup is being obese. No, because there are some risk factors you cannot modify. One of them is family history. The second one is being Black. There's not much you can do about that. So in terms of prevention, it's a yes and no answer. The best you can do is maybe optimize your weight. I hope that answers the question.
Thank you, Daktari. I heard you say being Black.
Yes.
Maybe you can just elaborate a bit on that?
Oh, being Black, I don't mean dark skinned, I mean African origin, Afro-Caribbean. Maybe it's more
Yeah.
politically correct. We don't mean being dark skinned, we just mean being of African or Caribbean descent. That in itself is a risk factor. That's why ideally, like all Kenyans of Kenyan origin, because we are Afro-Caribbean in descent, should be screened for diabetes in pregnancy.
That's quite interesting to learn. It's a very interesting. How does one how does one manage sitting in the office with the belly growth?
That one. Number one, your seat. And I always tell women, negotiate for an ergonomic seat. An ergonomic seat is a seat that has a curvature that supports your back properly, so that even when you sit, your back is well positioned. Secondly, encourage women every hour, stand up, stretch, take a walk, then come back and sit. That stretch helps you, relieve the tension and the pressure areas when you sit. So people sitting in the office is not a problem. It's just that now you have to adjust as time goes by.
Thank you.
Mhm.
I know sitting in the office when our bellies are growing is actually quite a challenge. Maybe we will be addressing that, and we will be encouraging mothers in our, as we
Mm.
continue on this Moms Club WhatsApp. And what causes missed abortion, and can it reoccur?
Okay, so first thing to understand is what a missed abortion is. So a missed abortion is a miscarriage when the baby dies within the womb, but you pick it up a couple of weeks later. So a missed abortion commonly occurs if the environment in the uterus was not conducive for a baby, or if the baby had a genetic abnormality that is incompatible with life. So if you see a baby is formed from a sperm and an egg, and these two should join perfectly so that the genes realign perfectly so that a baby is able to develop and form cells which are functional. If this realignment is not perfect, it increases the risk of a missed abortion. Also, there are conditions that make the environment of the uterus a bit unfriendly for a baby, especially conditions like pre-existing diabetes, they are a risk factor, or some forms of clotting problems in mothers. It's a combination of conditions like systemic lupus erythematosus. There are quite a number of conditions that predispose you to having clots in your body. They can also cause a missed abortion. So can it reoccur? Yes, if the cause is not addressed. For example, if the problem was diabetes and you still haven't managed to regulate your blood sugars, it will reoccur. If it was one of those conditions that predispose your body or make you more at risk of forming clots and you're not given medications to manage that, yes, it will reoccur. If it's a genetic thing, those ones are usually sporadic, meaning they don't quite reoccur. So can they reoccur? Yes and no, depending on the cause and whether it's addressed.
Thank you so much, Daktari. I am a first mom. Kindly advise on delivery. Can I choose an elective CS? What would you advise on the CS mode?
That one is a hot topic, eh? Because, okay,
I know, Daktari.
it, and I don't know how to, walk in the middle. So, from a medical point of view, let me first answer from a medical point of view, where I sit as an obstetrician and gynecologist. I actually encourage women to have normal vaginal births unless there's a condition that either puts her or the baby at risk, generally speaking. So there's no harm in trying. And I always tell the women, we are with you every step of the way. In case a condition arises and you're at risk or your baby is at risk, we will put interventions in place and even do that C-section if it will be necessary at that point. But also, when you look at it from a rights point of view, a mother can choose to have an elective cesarean section on maternal choice, but on condition she understands the implication of what that means, the anesthetic risk, the surgical risk, and also the implication that in the future, if she chooses to have a vaginal birth, if she didn't like the CS experience, it might not be very easy to go back because in our setup, vaginal births after cesarean section, our success rates are very poor. And secondly, our healthcare system does not provide the ideal setup for that. So it's a double-edged sword. But from where I sit, I encourage women to try. We are with you. If anything goes wrong, we are there. We will put measures in place.
Thank you, Daktari. I think I support you on that. We encourage our mothers to go through the normal process unless some complication arises. But we all have beautiful stories to tell about our labor pain. So when you choose an elective CS, we all miss on this lovely discussion.
Mm.
Daktari, maybe just mention on, is there any connection with dyeing of the hair? You know, when we dye our hair when we are pregnant, can it affect the baby? I believe here the viewer is talking about probably the chemical used, and maybe touch on any
Mm.
other chemical that may work on our beauty that maybe would affect the growth of the baby.
This question is not very easy to answer. And the reason it's not easy to answer is, you see, there are so many different companies that make these chemicals that we use on our skins and our hairs, and their formulations are very different. If you are to look at it from a scientific point of view, there are some studies that have looked at these chemicals and possible impact of pregnancy. And yes, some of these dyes have been shown to have a negative impact on babies. However, not all of them are a problem. So to demonize all of them in a blanket might probably be unfair. But what I'd tell women, for things which are not necessary, you can postpone them until after pregnancy, especially where safety is questionable.
Thank
I
you,
think that's what I
Daktari.
can say on the matter.
Yeah,
Yes.
thank you. Thank you so much. What weight is considered underweight? I am 3 months pregnant, but still the same weight I was at 1 month. That is 45 kgs. Though food intake has been a challenge. What could be
Uh,
your advice?
that's a difficult question to answer because, you see, for you to consider someone to be underweight, we actually use a BMI. That's it's an index you calculate depending on the height of the patient. You see, you could be 45 kilos and very short. So that will make your weight appropriate. You might be 45 kilos and tall like me. So that will make you severely underweight. So without knowing the height, I might not say whether she's really underweight or not. However, the other thing to note is that the first 3 months of pregnancy, because of those discomforts, the nausea, the pickiness of food, women actually don't gain any weight, and some of them even lose a little weight, maybe about a kilo to 3 kilos. So the fact that she hasn't added any weight at 3 months of pregnancy is not worrisome. In fact, I applaud her because she hasn't lost any weight. And hopefully, in the coming months, as the nausea goes away and she's able to eat better, her weight will improve.
Wow, that's I'm sure in the next 5 months she should have added some weight, Dr.
Yes,
Hello,
hopefully.
you talked about prolonged menses causing infertility issue. I have been
Mhm.
experiencing heavy flows lasting 7 days or more, upon which I did a scan and conclusion was sonographic finding of polycystic ovaries. Everything else is normal. Should this be a cause of alarm or what do I need to do? And I believe she implies okay, when it comes to conceiving.
Wow. You see, that's why we said whenever you have issues with your problems, have them evaluated. So, like this condition that was picked up, which is polycystic ovarian disease, it's actually a condition that gives you a form of hormonal imbalance, which can potentially delay fertility. And if she's trying to have a baby or get pregnant, I would actually advise her to see a gynecologist to walk her through that journey. It's not associated with infertility, but subfertility. Subfertility means your fertility is not optimum, and some interventions need to be put in place to improve your chances of conception. So it's not really a cause of alarm, but it's a condition that you will need to work with a gynecologist through your fertility life. And it's important not only now that you're trying to conceive, it is a condition that causes some other problems in your body, which will need to be addressed over time. Problems with high cholesterol, increased chances of getting diabetes, increased chances of getting hypertension, and some of these women with polycystic ovaries also have increased chances of getting thyroid disease. Now, this is the reproductive endocrinologist in me speaking. So it's not just this journey of getting pregnant, but also general wellness after that. So I would actually recommend that she sees a gynecologist to work with through this reproductive health journey.
Thank you. I'm sure she's picked it up and maybe she needs to have that done. Is ROGAM short for O negative blood painful? I'm not so sure.
All
Yeah.
injections are painful.
She seems to be scared. Maybe you can give her some word of comfort that all
No,
injections are
no,
not painful.
no. What
I
I'm
mean,
trying
are
to tell her
painful.
is
Yeah.
all injections are painful. This one is not more painful than any other injection. Like if she has had an injection in her life, it's the same. It's not extra painful. It's just the same as any other.
Thank you, Dr. Is it
Yeah.
possible for one not to? It's a 1 minute. Quick question: is it possible for one to not want? Okay, is it possible that after delivery you may not
Mm.
want to engage in intimacy? That I believe it,
Yes.
and I think I would want to rephrase that question because it has
Mm.
come up most of the time. When is the
Mm.
right time to have intimacy after pregnancy? And why do most of us lose interest in intimacy after delivery? Maybe I think.
Okay, there are two aspects to this question.
Mm.
There's a
Mhm.
medical point of view. When is it safe to engage in intimacy? We say it's safe to engage in intimacy. Number one, when the bleeding after delivery stops, because that means where the placenta has healed. And secondly, if you had maybe a tear that was stitched or a C-section, your wound has healed. On average, usually it takes about 4 to 6 weeks for your body to heal. So, from a medical point of view, by the time you're around 6 weeks, you should be quite ready from a medical point of view. However, your body being ready from a medical point of view and you being ready for intimacy are two different things. And what I mean to say is, you see, like for some people, pregnancy can be traumatic, delivery can be traumatic, the process of delivery can be traumatic. So sometimes the thought of anything going back there is quite scary for quite a number of women. And sometimes they need time to recover mentally from this. Secondly, whenever a woman gets a baby, it is tiring to care for a newborn. You don't sleep enough, you're stressed, sometimes you don't have enough support at home. So maybe intimacy is the last thing on your mind. And also your hormones. You know, the pregnancy hormones take some time to wear off. It takes some time for your hormones to go back to normal. It takes time for libido to come back. So when you combine all these things, the first few weeks after delivery, most women are disinterested in that. And we normally say you take your time, you can resume when you're ready. Some women are ready sooner than others. But of course, if still at around 2, 3 months, you're still feeling not ready, then maybe you should have a conversation, maybe with your doctor or your partner to address specific concerns for why you're not ready for intimacy. So it's complicated. You know, even the sexologists tell us your mind is the biggest sex organ. Me, as your doctor, I can tell you at 6 weeks you're ready to be intimate, but you feel mentally you're not ready. And in case you feel that way, then sometimes it's important to address the specific concerns you may have. Another issue women have is a lot of vaginal dryness, especially after delivery. That's because of the low estrogen levels. And this takes about 4 to 6 months to resolve. So, in case you're experiencing excessive dryness during intimacy, we advise you to use medical grade lubricant. That's a water based lubricant. There are several in the market, KYJ, KLY jelly, and so on, in case that is what is causing you problems. And also, if you resume intimacy and you're having pain, please see your doctor to see what the cause of the pain is. Some women, after healing from a tear in the vaginal area after delivery or episiotomies, can have pain, and sometimes it may be something that may need a medical solution. So, what I encourage women is be open, have those conversations with your partner, with your doctor. So, if there's a challenge, you're able to address and also refer you appropriately.
Thank you, Daktari. I know we've learned a lot from that. Now, how long does it take for excessive spitting to reduce? And also, how do I manage it? I believe I've been chewing a lot of gum, and I feel like this is causing or it's increasing my bloating?
It's a difficult question to answer. Generally speaking, the excessive spitting for most people resolves by the end of the third to the fourth month. However, that said, for some women, it may persist throughout pregnancy. The main issue is the algae taste in the mouth. Like we said, a strong tasting substance can reduce the need to spit. So, like you see some women taking a lot of mint or chewing mint-based gums or chewing ginger sticks or ginger-flavored substances to reduce their urge to spit. Um, Disclaimer, when you use mint and gum, if it has sugar, then you have to brush your teeth 2 to 3 times a day. Otherwise, you'll end up with cavities and your dentist will not be very happy about it. If that doesn't work, alternative is to just spit, but spit hygienically. Either carry a towel or a bottle to spit into so you don't keep spitting on the street. Yeah. But about the bloating, gum does not cause bloating per se. However, pregnancy causes bloating. Probably you're confusing that with the bloating that comes with pregnancy. Yeah, I hope that answers the question.
Thank you. What causes premature labor leading in preterm birth? The causes of labor.
That's a very, very detailed
Mhm.
question. But generally speaking, preterm labor can be caused by infections. It can be caused by trauma, like if you're injured, have an accident or something. It can be caused if you have things in the uterus which are occupying space, especially fibroids. It can also be caused by a weak cervix, broadly speaking. And if you have preterm labor, if it is not knocked off or managed, it will definitely lead to a preterm birth.
Okay, thank you, Daktari. I gave birth 16 years ago, and that was via a CS. And now I'm pregnant again. Is there a possibility that I'll have a CS or I can go the normal way?
That's a difficult question to answer. It's not the duration in between the cesarean sections that's the determining factor. It is the reason as to why you had the first cesarean section. What am I saying? You see, if you had a cesarean section because your bones are small, you see, chances are you still have the same bones 16 years later. So it might not change the fact that you need another cesarean section. So I think that's a discussion you should have with your doctor. Sit down with your doctor, explain if you can remember why the cesarean section was done, and then see whether there's possibility of having a normal birth. And also, there is a criteria we use when you're almost reaching term, like the weight of the baby, position of the baby, and a couple of other things we assess just before the end of the 9th month to determine whether you're a good candidate or not. So it's not a straightforward answer. And that is something you discuss in detail with your gynecologist so that you get a proper answer.
Thank you, Dr. Ari, and congratulations to her. 16 years is quite a difference. She feels like she's now a new mom.
I was
So
going to
we'll,
ask why 16 years, but then life happens.
yeah, but
Yeah.
congratulations. Welcome to the
Yes, yes.
Moms Club. I think Daktari is here for you. Maybe,
Yeah.
Daktari, you mentioned about safe sex. I believe you mentioned what you meant by safe sex, but you can just,
Yes.
repeat. And then once you're done with that,
Mhm.
just mention a bit in how safe is it to get into a dryer when you are expectant.
So for safe sexual practices, one of the things we want is to prevent new infections, either HIV or syphilis while you're pregnant, because it increases risk of transmission to the baby. So we are looking at preventing having multiple sexual partners. If you don't know your partner's status, always ensure use a barrier method. Also, safe sexual positions. We see the pregnancy progresses, there are positions which are not too good for the baby. But in the first trimester, it's neither here nor there because the baby is not too big. But that's what we are looking at. Then how safe is it to go into the hairdryer? It is quite safe, only that sometimes some women may get dizzy, but you see that's not a medical thing. So what I normally tell women, always communicate. It's safe to go to the dryer, but in case it makes you feel uncomfortable, you can always talk to your hairdresser to dry your hair using an alternative method. The problem is the heat. You know, women don't tolerate heat very well when they are pregnant, but it's not like it's a medical issue.
Thank you so much. Best sleeping position? Can you sleep on your back?
In the first trimester, yes, but after that, you sleep on your side.
Okay. How do you handle post-CS swelling in the legs after, how do you handle swelling in the legs after a CS?
Okay, so now swelling in the legs, the first thing to ensure is that she's not hypertensive, because also hypertension can cause severe swelling. And the other thing to note that it is normal for the legs to swell after delivery, whether it's CS or normal delivery. And the reason they swell is because, you know, when you're pregnant, you make extra blood, which goes to the placenta. When the baby comes out, it accumulates as fluid in your body, but your kidneys will gradually clear it out. So there's not much you can do about it. You don't need to take medication for it. Your body will handle it. If the swelling is excessive, then you can avoid hanging the legs when you're sitting and maybe put them up on a stool or on a couch so that you don't dangle them. Dangling can worsen the swelling, but it is not worrisome. It resolves on its own in about 2 to 3 weeks.
Thank you, Doctor. Is it better? Okay. I don't know if you'll be able to respond to this or we would rather pick it from the WhatsApp, but I'll just mention it. Is it better to have a specific doctor for delivery or work with a hospital doctor, stroke midwife? What are the advantages of both? You know, in this, you remain in the middle.
Yes, I am trying to be neutral. What I've always told patients is this: if you're having an uncomplicated pregnancy, and on condition no complication occurs during a delivery, even a midwife can take care of you. But the problems arise if you have a complicated, maybe obstetric history, if you're having a complicated pregnancy, then you might need to walk that journey with an individual who understands all the intricacies of your pregnancy. So that's the time I always insist. If you're having specific or special conditions or complications, now that one you need one hand. Because you see, it's difficult to meet a new person and give them your whole history in 5 minutes. So that one you need to work with a specific doctor through the whole journey plus delivery. So that said, is it better to have a specific doctor or a hospital doctor or midwife? There are many considerations to make. First of all, your personality. There are individuals who like what is familiar. So those ones would work better with working with a specific individual. The individuals who don't have any issue working with anyone, they can go with anybody. Of having your own doctor, of course, there's the personalized care, having somebody who knows you, understands your social circumstances, understands your history, and also there's the comfort of a familiar face. Disadvantages: sometimes the cost might be higher than using a hospital doctor because private practitioners tend to be a bit more expensive. Sometimes your doctor might not make it for your delivery. Life happens, or they could be attending to another patient, so that can be a downside. There was a time people used to say if you're a private patient, the midwives treat you differently, but I think things have changed now. It doesn't matter whether you're a hospital patient or a private patient, you're treated the same. Advantages of maybe using a hospital doctor is maybe it may manage costs because hospitals give packages. What else? Maybe they're always available, but also in some facilities, the doctor is also on call, which might not be any different from your own doctor. Do you always need to be delivered by a gynecologist? Honestly, strictly speaking, the answer is no. However, you can choose your health provider. If it's uncomplicated, a midwife can do. In all honesty, an obstetrician becomes very important if there's a complication. I don't know. I'm trying to stay neutral. Have I stayed neutral enough?
Yes, Daktari, you have stayed neutral. I wanted to comment, but since I'm also in that field, I prefer to remain neutral.
Yes, I'm trying to walk the middle ground and give information.
Yeah, safe grounds, eh?
Yes, yes.
Now, I think these two questions are identical. Please shed some light on conception after 40. And
Mm-hmm.
I have three children delivered through CS. The last birth was 8 years ago. In my
Mm-hmm.
40s, I have a desire to get a fourth born.
Okay.
How safe is it at this stage? I think both of them have some
Mm,
similarities. Yeah.
a pregnancy in the 40s. Now, let me start by saying the world has changed. Traditionally, women used to have their babies earlier, but currently, women are having their babies later and later in life. So it has become quite common to have women getting pregnant in their 40s. So if you are to ask me, my personal opinion is go for it. However, if you're looking at it from a medical point of view, of course, being pregnant in your 40s is a bit more complicated than getting pregnant when you're a little younger. There's, of course, increased risk of miscarriages. There's increased risk of some birth defects, especially Down syndrome. There's increased risk of getting a cesarean delivery as opposed to a normal vaginal delivery. You may also try and not succeed to get pregnant. There's also increased risk of diabetes in pregnancy, hypertension in pregnancy, and also preterm labor. But like we always say, even guys in insurance, they say a risk does not always translate to an event. So what I advise, if you still choose to try and have a baby in the 40s, go for it. However, start with preconception care with your gynecologist. Get a good doctor to walk with you through this journey. So, in case complications arise, they're picked up in good time and interventions put in place. So, being in your 40s should not deter you from trying. You try. If you get pregnant, we will walk with you through the journey. That's what I'd say.
Tari, I think you already touched on this one. I
Mm-hmm.
don't know if you have anything to add on because I can see we have so many questions and our time is running up.
Uh-huh.
What are the pros and cons for elective CS? I think you tackled that.
Yeah, we already tackled that.
We already tackled that. We can still we will still throw it in the Moms Club WhatsApp so that we can also
Okay.
still redo it again. There's a number that
Mm-hmm.
has been posted. Kindly join the
Mm-hmm.
WhatsApp Moms Club using that number so that we'll continue answering these questions. We'll be open throughout the day for the questions, and Daktari will be available to respond to them on WhatsApp. Now,
Mm-hmm.
any tips on pelvic floor exercise after therapy? Any tips on pelvic floor exercise after therapy? The
Uh,
therapy helped some extra. Okay, I'm not so sure, but I
I
feel it can be better. Okay, the question is not very clear on my end. I think she's trying to ask to which extent can she
mhm.
do the pelvic floor exercises?
So what we tell women while they are pregnant and after delivery is to do pelvic floor exercises, traditionally known as Kegels exercises. They're important because during pregnancy, the pelvic muscles become a bit lax because of the weight of the baby. And also, if you have a vaginal delivery, even a CS, the laxity is further worsened. So you might have problems with containing urine. Some women, they may even get leakage of urine, especially when they strain, like when you cough, when you jump, you feel a bit of a leak. So to prevent that, we encourage all women to do pelvic floor exercises after they deliver. Those are the Kegel exercises. I don't know, you told me you have physiotherapists coming in.
We'll be
Maybe
having
you can,
physiotherapists
yes,
coming in.
yes. Maybe
Yes.
you can request them to to describe how to do a Kegel's exercise, because one of the challenges we notice as gynecologists is that women exercise, yes, but they exercise the wrong muscles. So as a general rule, if you want to identify the correct muscle to exercise, when you're going for a short call and you're passing urine, try and stop the stream of urine. So the muscles that stop that stream of urine are the ones you should clench when you're doing the Kegels exercises. Generally, you should do repeats, 10 repeats, at least 8 to 10 times a day. And for women who are breastfeeding, I usually tell them the easiest way to remember to do them is every time you latch the baby, you start doing your Kegels. Because of course you'll breastfeed the baby at least 8 times a day. So if you do them every time you breastfeed, you'll manage to do them at least 8 times a day. But also I'd encourage you to have the input of a physiotherapist to also tell the women which other exercises they can use to strengthen the pelvic floor. It is quite important to prevent those leakages. And also, a strong pelvic floor is important in the sexual response. So it also enhances intimacy. So it also helps in other areas.
Thank you, Daktari. Stay put. We will be bringing us a specialist on the same one of these fine days. We'll also be
Yes,
bringing in a nutritionist and many, many other specialists. Feel free to
yes,
request types of specialists on the WhatsApp wall so that we work together. I believe, Daktari, you addressed about the chemicals. Somebody asked the gel you addressed. A
yeah.
cesarean scar 7 years later, still itchy with slight pain once in a while. I don't know if that is common. I tend to believe it happens sometimes. I don't know. Maybe you can elaborate.
Yes, it's common to have itchiness in the scar. However, that said, there are some types of abdominal scar formation. The commonest one is a keloid, where when you feel the skin around the scar, it's hard, it forms like a bump, which can also be quite itchy and for some people painful. So if it is flat and you just itchy once in a while, it's not a problem. But if the scar is hard, gets painful and itchy and forms like a bump or a lump, then you need to see your doctor to see whether the scar needs to be revised.
Thank you, Daktari. I know time. I'm just trying to look at the questions that you haven't addressed. My technical team will be moving all these other questions to the WhatsApp group. Kindly log in using that. And if your question has not been picked here, because there are quite many, they'll be answered there, and you can still throw in questions. We'll leave that open for some time. I think you mentioned when does the first trimester end? Maybe you can just say 2 months, 3 months as we move on.
Uh, 14 weeks, that's roughly 3 months.
Thank you, Daktari. And then what causes pulse and solution to that excruciating pain? What causes muscle pulse? I
Um,
believe it means in pregnancy or something.
okay, so muscle pulls are caused by two main things. The first one is, when you're pregnant, you have shift in how your weight is distributed, and also that tags on your muscles in ways that make a muscle pull more common than it normally would be. Also, sometimes there's been a theory of low calcium and potassium levels when you're pregnant. So, can you do anything about it? Well, traditionally, women used to be told to eat bananas. If bananas have high potassium levels, so if the problem was low potassium, it will sort it out. Also, some of the calcium supplementations we give can help with that, but it's not 100%. And also, maybe you can practice stretches, especially for the muscles on the front and the back of your thigh and your calf muscles. They also go a long way to preventing the muscle pulls, because one of the other challenges you have are taut muscles, which can make you have the muscle pulls.
Thank you, Daktari. I'll just ask two more questions because I have 4 minutes and I can
Okay.
see I'm being warned. One is a very
Right.
interesting question.
Uh-huh.
But before I ask that one will be the last one because it has come in my inbox. Cause of
Okay.
hemorrhoids post delivery and how to solve them.
So now pregnancy in itself is a risk factor for hemorrhoids. For two reasons. Number one, the constipation you get when you're pregnant can worsen hemorrhoids. Number two, the pressure of the baby, the weight of the baby on the pelvis can also cause blood vessels in the pelvis to swell. And some of the blood vessels you have in the pelvic area are the ones around the anal opening, which can form hemorrhoids. For most women, by the way, if it was caused strictly by pregnancy, it resolves on its own. You just needed to give it time. For most women, between 6 weeks to 3 months, the hemorrhoids have resolved. Um, One of the things you can do to keep them from getting worse is to make sure you're not passing hard stools. So taking a high fiber diet and hydrating enough. High fiber, lots of fruits, lots of vegetables, lots of whole grains uh, can can increase the fiber in the food, making the stool soft. If it's really bad,
I think we lost Daktari, but probably there is an issue with her network. But all the same, I think we've had a beautiful time. Uh, I don't know. I think I can see her back. Daktari, I don't know if you're back for closure. Probably, I think she got her network lapse. But Daktari, I don't know if
yes,
you're back for closure.
yes, I'm here. Can you
Okay,
hear me?
continue. Yeah, I can hear
Yeah,
you.
I'll say if it's also really bad, you can also use stool softeners. But if it's pregnancy related, by the time you're 6 months postpartum, it should have resolved. However, if it's really bad, then you can have hemorrhoid treatment done by the surgeons. Hemorrhoid treatment is required if they're very painful. If they have come outside the hemorrhoid, sometimes they come outside and look like berries, or if they're infected. If those three things happen, then you need to see your doctor immediately. There are some surgeries to remove them. So don't suffer, even if I've said they will resolve. If they're bad, then they can be removed.
Thank you, Daktari. This is the last one. I think because my time, I have 1 minute.
Okay.
Uh, the question has come to my inbox, and what is the risk of breastfeeding your hubby or your partner when you are pregnant? As I
Okay.
said, it will be the
So,
last one.
okay. Now I will speak strictly as a doctor. The only challenge you might have when you breastfeed, you stimulate the nipples. And when you stimulate the nipples, there is a hormone that's released called oxytocin, which can trigger uterine contractions. And if you are predisposed to getting preterm labor, it can stimulate preterm labor. So that will be the challenge.
Okay, thank you,
Mm,
Daktari. I've also
yes.
learned,
Mm-hmm.
and we are exactly at 11:30. So
Yeah.
thank you so much, Dr. Muthoni. We've learned so much. We believe we would want,
Uh-huh.
I can see a lot of congratulations coming in. Would want to have
Uh-huh.
you more and more and more. Would
No
actually
worries.
love to see you work with us, and we really
Uh-huh.
appreciate for the time being given. Thank you, and thank you so
Mhm.
much to our viewers. The WhatsApp will be open in a minute. Please throw in your questions. And I've also mentioned it's not only this club is not only for mothers who are expectant or who are planning or who are delivering and all that. It's also for our mothers and young ladies who are struggling to conceive or having challenges to conceive. You've heard Dr. Muthoni is a fertility specialist. Please join the WhatsApp, come in so that we can have a discussion and then we can see the way to help you. As she had earlier advised, Dr. Muthoni is based at the Women's Clinic located at Fortis Building on 5th floor. Kindly pay her a visit, or she, I think, did you share your number, Daktari? Maybe you can just tell us your number before you leave.
Okay, so my number is 0722 330 947. I'll also type it in the chat. And our office number is actually on the slides that we projected.
Thank you so much. We are humbled. We are really, really humbled. Otherwise, to our mothers who are expectant, we wish you a very safe journey. Remember, we're here with you. For the ones we are breastfeeding, we are also planning something. For the ones anticipating, stay put. We'll also be talking about the journey. Also, we'll be sharing our meal plate. As we said, we'll be bringing all types of specialists to the WhatsApp. So stay put and walk with us. Otherwise, karibu sana. May God bless you and have a lovely weekend ahead.